Tony's now is Dr. Kate Tulenko. She's founder and CEO of Corvus Health, a global health firm. Kate, it looks like there's a lot going on the COVID front. I want to ask you about the schools in Los Angeles. Before I get to that, I want to get your take on the president's steps today as he laid out the facts surrounding the pandemic and then his efforts to try and get more people vaccinated. Is it going to be much of a difference maker, do you think?
Yes, he announced a number of very large programs that I think will make a difference. One is employers. Any employer with 100 employees or more will have to either vaccinate the employees or test on a weekly basis. Then you have federal employees. They all will need to be vaccinated. Then you have health workers. Any health worker in a facility that receives Medicare or Medicaid, which is pretty much every health facility, will have to be vaccinated. And also they're doing things on the testing front. For example, providing more money to schools to be able to test, but also through a deal that they brokered with Walmart, Amazon, and other large retailers, they will offer testing kits, at-home testing kits at cost. So this will enable families to test themselves and, make sure that they're not infected before they visit family members or attend an event. Also, Biden announced a very large new public health workforce program, a public health AmeriCorps with CDC, which will most likely be able to train tens of thousands of new public health workers. Even before COVID, the U.S. had a shortage of public health workers with tens of thousands of vacancies.
Owen, in his report, said it's a carrot and stick approach. Should he have pulled out the stick a little sooner, though? I mean, we've seen this surge. Could this have been done earlier, do you think?
I think that the Biden administration tried to be cautious, tried to wait until the Pfizer vaccine was fully authorized by the FDA, which it is for adults. But, there are many people who still haven't had the vaccine, and I don't think they'll be persuaded. Just to give an example, we see people refusing a vaccine, which is fully authorized by the FDA, and preferring to get Regeneron, which is only under emergency use authorization. So that, doesn't have any type of internal logic. So I think that the Biden administration waited, for those reasons to give those people time, but in the end, they have to be more strict.
Let's get to the Los Angeles School District. This is a big step. Can it be a domino effect? Do you think other schools will follow suit?
Yes, certainly. Los Angeles is the largest school district in the country, so a lot of school districts are looking for them. I think, as your reporter mentioned, that the vast majority of the lawsuits that come out of this will be lost, that the federal government will win. But I'm wondering about lawsuits around, children 12 and younger receiving the vaccine, because it currently is under emergency use authorization for children. So I think some of those lawsuits might be won, and we would have to wait until the vaccine was fully FDA authorized for children before schools can enforce it. But we'll wait and see what happens.
Let's talk a little bit about capitalism. The economy's been battered by this. It seems to me a lot of companies are just kind of getting fed up as well. Delta Airlines, an example, we talked about that. Look, you don't want to get the shot, that's fine. You're just going to have to pay a lot more for your health care. And we're seeing more and more of these kind of punitive efforts by companies. They're just kind of getting sick of this. Is that going to have an impact?
Yes, I think it will, and that's a wonderful example of what's called decision architecture, that you don't want to take away people's choice. People have a choice to not get vaccinated, but they have to pay their fair share, $200 extra a month for their insurance, because certainly when and if they get COVID, it's going to cost their insurance company hundreds of thousands of dollars. I also think we're seeing the tide turn politically in Florida, that the cases are just so high there and things are so bad. For example, in Orlando, because there's such an oxygen shortage, people have been told not to water their lawns because liquid oxygen is used to purify household water, and they need that oxygen for people to breathe. And, tens of thousands of sick people and hundreds of thousands of people with long COVID is not good for business.
I guess it's if you can't water your lawn, then you get fed up, I guess, for some. Kate, always a pleasure talking to you. Thanks so much.
Thank you.